All right, in this video, we are going to go over coronary circulation. So coronary circulation is kind of special because the heart needs energy in order to actually supply the rest of the body with blood. And in order to get that energy, it needs oxygen, and therefore it needs to have a continuous supply um, of blood. Now, when I say continue, I mean the blood constantly has to be there, not that it's always moving. Um, so the uh, peak of the circulation is going to happen during ventricular relaxation. That's known as diastole, and the diastole. The circulation is going to drop dramatically during ventricular contraction, which is systole. Now, the coronary arteries, which you'll see right here, they arise from the aorta just above the aortic semilunar valve. Um, and then you have a lot of arteries that are going to be on the surface of the heart. Those are your epicardial arteries, coronary arteries. They are going to be branches that travel along the sulci of the heart. Now, there will be some places where anastomosis form. That would be, for example, in like this region right here, where the blood vessels combine, and that provides alternative bloodways. But these are limited and therefore do not provide major protection against blockages. Therefore, a blockage is going to be very dangerous to the heart because without it, the heart muscles will die. Coronary veins are going to run mostly parallel to the coronary arteries. Most of them are going to empty into the coronary sinus, which you find on the posterior side of the heart, which is going to empty into the right atrium. All right, so let's take a look at the coronary arteries. The coronary arteries, the two main ones are going to be the left coronary artery, which is going to serve the left atrium, the left ventricle, and the interventricular septum. And then the right coronary artery, which is going to serve the right atrium, portions of both ventricles, and the cardiac conduction system. The left coronary artery is going to branch off to give the circumflex artery, which is going to go around on the left side of the heart and then go around to the posterior, and then the left coronary artery is also going to give rise to the anterior interventricular artery. So this is on the anterior side, and it separates the two ventricles. The marginal arteries are going to be derived from the right coronary artery, and you can see that the circumflex artery also contributes one there. And then the right coronary artery will also provide circulation down the posterior of the heart along the interventricular sulci. So it's going to go down and separate the two ventricles on the posterior side. All right, if we look at the venous circulation of the heart, you'll notice that they run mostly parallel to the coronary veins. The main draining component is going to be the coronary sinus. So the coronary sinus, most coronary veins are going to drain into that. Some of the larger branches of the that go into the coronary sinus include the great cardiac vein. So it starts over here on the anterior side along the interventricular sulci, goes around and is going to then go parallel to the coronary sulci and meet at the coronary sinus. The posterior cardiac vein, the small cardiac vein here, and the middle cardiac vein are also going to go around and ultimately meet at the coronary sinus. So the great coronary vein is going to go on the left side of the heart, while the small cardiac vein is going to go on the right side of the heart. And then the middle cardiac vein is going to be one that goes along the posterior interventricular artery. Now, there are a few other cardiac veins, especially on the anterior side, that are not going to drain directly into the coronary sinus. Instead, they are going to drain into the anterior surface of the right ventricle. It's not really shown here, them draining into there, but that does happen. All right, so here is a color picture of the veins together, so you can see how the arteries and the veins are going to coincide with one another on the anterior side. So you can pause this and take a look at it, and then you can see the same arteries and veins that are running together on the posterior side. All right, so the circulation of the heart is going to be very important, and disruption in this can lead to serious complications, especially in the case of coronary artery disease, which is the leading cause of death worldwide. It's caused by a plaque buildup inside the arterial walls. Plaque contains things like cholesterol, connective tissue, white blood cells, smooth muscle cells, and then this buildup leads to an atherosclerosis. So plaque accumulation leads to atherosclerosis, which is a hardening and narrowing of the arteries. This produces an obstructed blood flow and reduced vessel compliance. Therefore, you are going to get decreased blood flow to the tissues. That is known as ischemia. Because you have a decreased blood flow, that is going to in turn result in hypoxia, low oxygen, specifically insufficient oxygen, and then can lead to a myocardial infarction. So this increases your risk for that, which is a medical term meaning heart attack. The disease progresses slowly. It can often begin as early as childhood. The earliest signs tend to be fatty streaks in the blood vessel walls, and then it progresses through the rest of your life. Risk factors include smoking, family history, hypertension, obesity, diabetes, high alcohol consumption, lack of exercise, stress, and hyperlipidemia. Primarily, the first treatment option is going to be to have lifestyle changes like dietary and increased physical activity to do that, and then medications that will help to lower your blood pressure, cholesterol and lipids, and clot formation. You can have surgical intervention in the form of an angioplasty. This is a procedure that would mechanically widen the artery, so you're going to make this wider to help increase blood flow. So how this works is you insert a catheter. Usually you go up through the leg, you guide it to the blockage, and then you inflate a balloon that compresses the plaque and opens the vessels. And then you deflate and remove the balloon, and then provide a stent, which is the mesh support, to help reinforce the vessel walls. These stents have been used routinely for over 40 years. Something else that can be done is a coronary bypass surgery, where a grafted vessel is used to bypass the blocked coronary artery. This can be effective during an active myocardial infarction, but it does not actually seem to increase the long-term longevity of the individual, and can cause complications like reduced mental acuity, especially in patients with CAD that seems stable. So lifestyle changes in medical therapy can be equally, if not more effective in long-term management compared to the coronary bypass surgery. All right, so one of the complications, as I mentioned, was a myocardial infarction. So when we talk about a myocardial infarction, meaning a heart attack, that is talking about the death of the cardiac muscle too that's due to that ischemia and hypoxia, so that low blood flow and low oxygen. Um, Most commonly, this is going to be due to the blockage of a coronary artery due to atherosclerotic plaque buildup. This can also occur, however, when a piece of unstable plaque elsewhere breaks off and lodges in a smaller coronary vessel. The blocked artery results in myocardium deprived of oxygen, leading to cell death. The symptoms that are classically with it include angina pectoris. This is a retrosternal, meaning beneath the sternum, chest pain. In males, it oftentimes will radiate to the left arm, but does not seem to do that in females. And that's a reason why, even though heart disease is prevalent in women, it has been historically underdiagnosed in that. It can also result in dyspnea, which is a shortness of breath. Can lead to palpitations or irregular heartbeats, nausea and vomiting, diaphoresis or sweating, anxiety, and syncope, which is a fancy term for passing out. Now, the symptoms will overlap with anxiety or indigestion, so a differential diagnosis is critical. And you can have what is known as a silent myocardial infarction. That is when they occur without any symptoms, and that happens in anywhere from 22 to 64% of them. So one thing that I want to mention is that myocardial infarction is different from cardiac arrest. Cardiac arrest is the result of electrical failure that causes the heart to stop pumping, while the myocardial infarction is the actual death of the muscle cells. Myocardial infarction can lead to cardiac arrest, but cardiac arrest can happen independent of a myocardial infarction. The risk factors for this include having cardiovascular disease. Your risk increases with age. If you smoke, you should stop smoking because this will greatly increase your risk for a heart attack as well. Having high LDL or bad cholesterol and low HDL or good cholesterol also increases your risk. Hypertension, having diabetes, obesity, not being active and being sedentary, having chronic kidney disease, and then alcohol and illicit drug use seem to increase your risk. The immediate treatment for myocardial infarction includes supplemental oxygen to help provide oxygen to the tissues that are dying, aspirin, which will help reduce the clot formation, and then nitroglycerin, which is given sublingually or under the tongue, which will result in vasodilation via the nitric oxide it produces. Tests for this, so you can do an ECG, which will result in changes in the ST segment in the Q wave. Imaging using an echocardiograph or a cardiac MRI, and then certain blood tests like testing for creatine kinase MB and cardiac troponin. Both of these things are released when cardiomyocytes are damaged. So that's a way of detecting whether that has happened. Long-term treatment involves taking thrombolytic agents to help dissolve clots, taking heparin as an anticoagulant, balloon angioplasty and stent replacement to open the blocked vessels, You can use the coronary artery bypass graft to reroute blood around the occluded areas. So this, if you have had a myocardial infarction, this can be beneficial, but having a bypass without the myocardial infarction is generally not. Severe damage may require a heart transplant or a device to help assist in pumping. There have been some artificial hearts, but those show limited success. But nonetheless, research does continue with those as a means of dealing with this. All right, so that is what I have for you on the myocardial or on the coronary circulation. In the next lecture, we will be talking about heart physiology.